Hi guys. All right, so we are gonna be reviewing this final game, the Final Frenzy. This is only over cardiovascular health through weight management. So those last like 5, 6 chapters. In order to review for the comprehensive exam, I'm going to provide you access to the games that we've done previously. So you'll find those in the modules as well. You'll have to scroll through. I believe you'll find one in like week 4, and then in week 8 probably. So you'll have access to those previous games that you played to prepare for exam 1 and 2, and then this game as the final one to prepare for those last few chapters that will be a part of the final exam as well. All right, so I'm just going to kind of go through this. And sorry, my throat's a little is a little gunky today. So, all right, let's go through this. So, cardiovascular health. This is considered normal, healthy blood pressure, and I think probably everybody knows what that is now. We talked about the recommendation being 120 over 80. However, there's a lot of organizations, institutes now that are coming out and saying they would like to see even lower, such as 115 over 75. And sometimes that would be gender-based as well. So usually we'll see a little bit lower blood pressure in females. So for example, this question, list a non-modifiable risk factor for heart disease. Simple ones that you can think of, right? Like it's age, sex, background, so what your family health history looks like, ethnicity, and then that C-reactive protein, which we talked about. That C-reactive protein is something that physicians look for to see if it is elevated. It's an indication that inflammation is present. Not something you have a lot of control over. Oh, sorry, this one has gone outside of our screen. Uh-oh, back up here. So this says the diet limits fats, oil, or this diet limits fat, oil, sweets, while including meats, poultry, fish, fruits, vegetables, and whole grains. And it was created to manage cardiovascular disease. And there's a few different diets that we talked about, but this one is specifically the DASH diet. And really its goal is to, again, it's including foods that are really low in like sodium, for instance, and those unhealthy fats. So the DASH diet is what we're looking for here. Okay. I skipped one, so I'll go back to it. The term used to describe chest pain caused by blood vessel, usually during exertion. This is referred to as angina. And I think I skipped this one. This is the recommended sodium intake for those with hypertension. We talked about for those who are healthy, we're looking for about 2,300 milligrams. But for those that have already been diagnosed with hypertension, we're looking for less than 1,500 milligrams per day. Okay, let's move on to diabetes. This is a type of diabetes that cannot be prevented, and it is due to an autoimmune disease, so cannot be prevented. And it used to be one that had a different name, right? They called it juvenile diabetes because it was being diagnosed in much younger individuals, but now we're seeing it even being diagnosed in individuals later in life. And this is that type 1 diabetes. So this is one that has to be controlled with insulin because the beta cells are just not producing any insulin to get the glucose to where it needs to go. This is the term used to refer to the process of body cells resisting the action of insulin. So sometimes really pay attention to these questions because sometimes the answers are really embedded within them. So the resistance of insulin, referred to as an insulin resistance. And if you remember those 4 things that were a part of being diagnosed with metabolic syndrome, insulin resistance was one of them. Ketoacidosis results from, and that's when we have the glucose is not getting to the cells, right? Maybe it's a resistance, maybe it's because type 1 diabetes and they haven't been dosing insulin. Whatever the cause, for some reason that glucose is not getting to the tissues to be used for energy. So fat is being used to burn, or is being burned and for that energy, and the ketones are a byproduct of that fat being burned. And so ketoacidosis means that the blood has become acidic with those ketones because of the byproduct of fat now being burned. And that's still going to tell us that that glucose level is still high because it's not getting to where it needs to go. So sometimes if somebody is wanting to, another way to look at how well the body is utilizing the insulin, or if there's an insulin resistance present, then what they can do is buy those ketone strips and see if there are ketones in the urine. And if there's ketones in the urine, then that might give us an indication that either the blood glucose levels are high and the glucose is not getting where it needs to go, or they are actually in a state of ketosis, right? Not ketoacidosis, but ketosis, where their goal is to be burning fat and to not be utilizing those carbohydrates. This is a diabetes-related condition in which alters the sensation of the hands and the feet. So we talked about this as peripheral neuropathy. And we'll see that that's why it's really important for diabetics, especially as they get older, if they're unable to have somebody kind of check out their feet, make sure that they're getting really good care of their extremities, because they can't always feel what's going on. They can't feel if they perhaps have a lesion or something happened. And if that's the case, then that could become infected. What is the value of the glycated hemoglobin, or A1C assessment? So remember, this is a 3-month average looking at blood glucose control. And we talked about how those who are healthy, we're looking at, values of 4, 3, 4. But for those that have a severe insulin resistance or trouble managing their blood glucose levels, we could see very high values of 10 or more. But it does give physicians a really good indication of what that blood glucose control has been looking like for that 3-month average. And oftentimes what they'll do is, if somebody is not showing changes throughout that 3 months of showing better control of that blood glucose, then oftentimes that's when they're going to intervene with some medication. All right, moving to cancer and Alzheimer's. I kind of packed these two together here, but the recommended frequency of strength training for cancer survivors. And you've heard me say this before, but if you're unsure, always go for 2 to 3 days per week. So the same recommendation as what we're seeing for a healthy adult. The number one preventable cause of cancer, and I think most of you guys know this by now, that is that cigarette smoking. Remember, I think I said in class, but there's a lot more people that are diagnosed with breast cancer typically than lung cancer, but lung cancer tends to be tends to have a higher death rate. So when somebody is diagnosed with lung cancer, it's usually fairly progressive and there's not a lot that can be done. Research suggests that having this disease increases the risk of Alzheimer's. We were just talking about this disease, and that's that diabetes. Type 1 and type 2. So remember, any issues with the blood vessels that we're seeing connected to diabetes, as well as those connections with heart disease, all of those things have been connected now with Alzheimer's. Beta proteins that clump together between the nerve cells. So again, this is specific to Alzheimer's disease, and those proteins are called those amyloid plaques, and they clump together, right? And when all this clumping starts to happen, really our connections, our communication really starts to slow down. It's being interfered with. This is a diet crafted to reduce the risk of Alzheimer's that is showing promising results, and it really has. I believe the percentage was somewhere between 20 and 30% of showing less likely to develop Alzheimer's disease. and that's that MIND diet. And this is kind of a combination of the Mediterranean and DASH diet and that MIND diet. There's a lot of focus on eating berries, eating nuts, drinking a glass of wine, perhaps one day, the red wine, and sometimes and particularly depending on how the wine is made, eating seafood once a week, and really trying to limit sweets. So that's the MIND diet, and yeah, it's been shown to be pretty effective. But I do think it matters when you start that diet. If you're trying to start that diet after someone is already very progressed with Alzheimer's, I don't think that they would see the results. The recommended dietary intake of calcium for adults between the ages of 19 and 50 years, hopefully you remember that one, is 1,000 milligrams. There are two negative factors that influence bone balance. Two negative factors. So we talked about several things, not having enough protein in the diet. Definitely being a smoker is going to rid the system of the oxygen and nutrients necessary. Living a sedentary lifestyle, so you're not getting that stimulus to increase bone mineral density. Have maybe a loss of estrogen or a hormonal imbalance, and excessive alcohol consumption. This is a local degenerative joint disease, so this is our osteoarthritis that we'll typically see, in knee joints, hips, definitely depending on somebody's lifestyle, what type of job they worked, what type of sports they were involved in. It could be shoulder. So osteoarthritis, again, it's local, so local to the specific joint. And this type of arthritis includes symptoms that develop gradually and affects joints throughout so it's more systemic, okay? And this is that rheumatoid arthritis. So this is one that can, again, it kind of travels. You'll definitely see it affect the joints, but it could be affecting several joints at one time. And this is one that has been considered to be autoimmune as well. This is considered the most promising and safe supplement for those with arthritis. So this is one of those supplements where if you're talking to grandma and grandpa and they, are talking about joint pain, etc., this is one that you should feel fairly confident in recommending to them, and that would be that fish oil. So definitely been probably the safest, and just probably showing the most consistent results with those that are taking it consistently. All right, let's move to weight management. Being in energy balance means that the calories expended are equal to the calories consumed, right? If we're in a positive balance, that means we're intaking more calories than we're expending. If we're in a negative balance, that means we're expending more calories than those that are consumed. And that's really what comes the theory behind either putting weight on, losing weight, or maintaining weight. The amount of weight loss recommended per week, that is going to be 1 to 2 pounds. If somebody is losing more than that, or some diet is saying, or supplement is saying that you could lose, 5 to 10 pounds in a week, that's probably not done in a healthy way. So ideally, we're looking at 1 to 2 pounds per week, which tells us that if a person is healthy, they could be losing 4 to 8 pounds, maybe 10 pounds per month. And sometimes when people just aren't really seeing that quick weight come off, then that's why they quit doing what they're doing. They don't have the patience and they don't think it's working. This suggests that everyone has a biological weight that the body likes to maintain, and attempting to change it is very difficult. This is that set point theory, right? So even if somebody goes on a diet, they lose weight. If they stop that diet or they try to return to their usual living habits, then it's natural for their body to want to go back to what it previously weighed. So set point theory is what we refer to this as. The three major contributors to energy expenditure, this is hopefully one that you definitely know by now, as it's been repeated a lot throughout the semester. But that's that basal metabolic rate, right? Or resting metabolic rate, the thermic effect of food, and then the thermic effect of activity. Okay, last one here for weight management. This suggests that humans slow metabolism and store more body fat in times when food is scarce. This is referring to that thrifty gene. And that thrifty gene theory, again, makes sense, definitely during times of plagues or times when food was very scarce. But it can also be applied to, many think that it's true, when individuals are really limiting the amount of calories that they're intaking. So it's saying that those calories that are being taken in are perhaps going to be stored as body fat because the body thinks that it is being starved. So that is the thrifty gene theory. Okay, I do have one final question here for Final Jeopardy. Just go to the final question here. So I think this is a good one. This might be something that you see on the exam. It says untreated chronic stress has been found to contribute to some health conditions. Name 3 of these health conditions. And at this point, this should be fairly easy because there's a lot, right? Anxiety, insomnia, muscle pain, high blood pressure, weakened immune system, depression, obesity, heart disease, already also been linked to gastrointestinal distress. So there's a lot. So just be ready to, be able to list at least 3 of those. Okay. So again, I'm going to release this and you guys will have access to all 3 of these games in preparation for the final exam. If you have any questions about these while you're reviewing them or anything like that, please don't hesitate to reach out to me, shoot me an email, and I'll get back to you as quickly as I can. All right, have a great day. We'll talk to you later.